Hi, Joe. It feels strange saying thanks for joining me on our Meet the Experts series. So we have today with us Joe of Joe Mama Physio, and we're going to talk about diastasis. So Joe, do you want to just kick us off and tell us what is a diastasis?
Yes, so a diastasis, you might have heard it called diastasis recti, or an abdominal separation. It basically refers to widening and thinning of a connective tissue that joins both sides of our sort of six-pack muscles. So this tissue is called your linea alba, and it can get widened and lengthened through pregnancy, which is what it's designed to do. But if that's prolonged and excessive, we generally refer to it as a diastasis recti, which can then affect your function and the look of your abdominals.
And Joe, how can someone check for diastasis?
Yeah, and it can be quite difficult if you're not used to feeling your tummy, which we know don't generally do this a lot, but we'll post a video on it as well. But main thing to do is you're trying to find the tissue between those two sides of your six-pack muscle and check it in a few different areas. And we do a little sit-ups or a little lift of your head and shoulders. And we're trying to gauge an idea of, one, how far apart those two sides are, but most importantly, the sort of tension through that linea alba. So is it particularly soft? Do you feel like your fingers can go further in? So how deep is it? Or is there some firmness there? So we generally say check it nearer the top, around your belly button, where typically it's a little bit wider, and that's where our bumps are generally bigger, and then a little bit lower down. So lying down's much easier if you're starting to feel it on yourself. And just get your fingers in between those two sides, lift the head and shoulders, and just take note of that tension and that width.
And I think we have a video how to on our YouTube channel, right?
Yes, we do.
Yeah, so if you're listening to this and you want instruction based on demonstration, which is sometimes easier, right? We have that on our YouTube channel.
Yeah.
Okay, so next question, and we always get asked this: can I prevent it in pregnancy? Because if you're pregnant and listening to this, you might be, slightly worried about the fact that your abdominal muscles are going to separate. So, what about in pregnancy?
Yeah, and I think this is massive, isn't it? Because we both have so many women come to us who are absolutely terrified about this splitting or separation that's going to occur. And unfortunately, there is a lot of scaremongering around the internet and around some health professionals as well. And it's really, really important to know that our bodies are designed to house our little humans, and that 100% of women will have a degree of a separation. We need it. Our body's designed to do it, to allow the baby to grow. So don't fear it. There's a lot of people say, well, don't rotate, don't lift your other toddler and all these kind of things, which are just not practical. And the main thing is that we can do a few things to minimize it. So avoiding really excessive load on your abdomen. So things like planks, heavy crunches, really, really heavy lifting if you haven't got the control, potentially can add to it. But please be really reassured that it's a natural process. And on, the majority, within the first few weeks and months post baby, there'll be a natural recoil of those tissues. And you may not really even notice a problem. For around a third of women, it will become a little bit more prolonged. And that's the time then, if you're noticing things that you might see, just more of a ongoing bulging after a few months, or doming or toning of your tummy muscles, you may find that they're a lot weaker, or you're actually having abdominal pain, sort of more of a sagging of the skin and a different look. They're signs that you may have a longer lasting problem, and that's when you need to see a health professional who's trained in diastasis, whether that's a physio, a personal trainer, your doctor, someone who can give you just some more specific advice. But the main thing, that don't panic, especially in those first few weeks as well. There can be a lot of people who go on 1 week postpartum and I think I've got a diastasis, and it's okay. Be really reassured that you're not just supposed to then stand like a robot and not pick up your baby. You have that all the time as well, don't you, Bets? Don't rotate, or I won't pick up my toddler. That's not mum life, is it? We have to still move, and our bodies are designed to move, and actually that movement will help a diastasis heal and get our tension back.
Yeah, and we have that section in on our website too, of things you can do to help promote healing in those really early weeks. So anyone, we probably haven't got time to go into it today, but anyone who wants some extra information can refer to that.
That's really important, because you're not told that, are you? And I know you do a brilliant chat through the 4th trimester of just things that you can do, breath strategies, or pelvic floor lifts at certain times, and that's going to really help your diastasis heal. And it's just the things we're not told that we should be told.
And I've had some great conversations recently with ladies who've had the leaflet. And I think if you're not based in Cardiff, I don't know how widespread it is, but we get in Cardiff, in the Vale, we get a leaflet from the physios that tells you those things, but they just seem so abstract. So if you want some demos and people to talk through them, then we definitely covered that, right?
Yeah.
Okay, next one. So, kind of answered my own question. So what can I do to help my abs heal post-birth? So what kind of things can women do?
So from a holistic point of view, staying well hydrated, eating really well, all of these things are just natural healants in themselves. So avoiding constipation, which can be a massive problem in those first few weeks, which is just going to add to a little bit of pressure out. So really look after yourself as well as little one. Whether that's...
So what about a collagen supplement? A collagen supplement, is it?
Yes,
sorry,
yeah,
collagen,
definitely.
Or a bone broth or something.
Yeah, great shouts. They're all really, really good, and just to make you feel a little bit better as well. And it's still similar to in pregnancy, in those first few weeks, not adding a really excessive load to your tummy. So, and not that anyone would want to day one post baby, but don't start jumping into your crunches and things. And let the body have some healing time. And that would be if you broke your leg, that would be if you'd pulled a muscle. Exactly the same thing. We need to protect the areas a little bit at the start. So that's going to involve doing your pelvic floor work as soon as you can. That's going to encourage our deeper abdominal muscle to work as well, using some breath strategies. So if you're getting out the chair, exhaling, which is going to encourage our core muscles to support us a little bit more. A big one is not just sitting straight out of bed, which I know when you're up for like the 12th time that night is hard to remember, isn't it? But just rolling onto your side is way more protective for your tummy muscles. And same with the chair, coming rather this big lean forward, coming to the edge, and again a little pelvic floor lift before you come forward. All of those things might just sound really subtle, but they're just going to encourage your body to do what it's designed to do, which, like I say, in a majority of women it will.
They sound so subtle, don't they? But they're such a huge step towards healing in those early weeks. Yeah. I'm trying to think what else we cover in the website that we could really briefly talk about. So we've talked about breath strategies, we talked about movement patterns, we talked about core as a whole, like activating deep abdominals. No, I think we've covered most of it.
Yeah, perfect.
So we've got a couple of questions from Instagram. Using a baby carrier. So what about if you suspect you might have a diastasis, but you want to keep your baby nice and close?
Yeah, of course. And I think you and I are really similar, Bets. It's, the woman's at the heart of it. So if that's what they want to do, then that's what help support them to do. And, that's reality, isn't it? You might need to have your baby in a carrier so you can walk your other 2 kids to school or get on with some home housework. So, main things we'd say is get a really good fitting carrier, because that's going to make you feel supported, make little one feel supported. So it's really worth investing in a good carrier. And there's loads of people who give advice on that. We work with Julia in Cardiff from Carry Me Close. She's fab, and she can give you really great advice on the best ones. Limit, potentially if you have got a diastasis, you have, and limit the amount of time, because you will feel a little bit weaker to start. And having that extra load, there is still a little bit of extra tension. So little and often is a better bet. And think about your posture. So if you've heard us talk before, we talk a lot about kind of our core system as a whole. And that includes our diaphragm, our deep tummy muscles, our pelvic floor, and our deeper back muscles. And and this kind of integration and teamwork of those muscles works better if our pelvis is in as much connection, our ribs are in much connection with our pelvis as possible. So if we're leaning back a lot, tummy muscles are just going to push out, and that's going to add to some pressure in your tummy and a little bit of lengthening through them. So trying to get yourself as upright as possible, again, a good fitting carrier will help that, but not going back into those long positions that are just going to make your back feel horrendous and add to tummy pushing out. So, and as you get stronger, it should feel a bit easier as well, shouldn't it?
Yeah, no, that's true. And it's so true, isn't it? You put the baby carrier on and you almost go back into pregnancy posture. So just that little bit does help.
Yeah.
Okay, thank you. And one more, always get this one. So I've heard that I can't go back to sit-ups and planks. What's your advice?
Oh,
I'm just giggling. We deal with it a lot.
Yeah, we hear all the time. And I think it goes back to the scaremongering. It's quite old-fashioned now that we talk about bad exercises and good exercises. That was a thing of the past, that sit-ups are horrendous and so are a plank. And well, actually, they're brilliant exercises. They load our abdominal wall, but they might just not be the most appropriate exercises at certain stages. Whereas for others, they're the best exercises that have helped their diastasis heal. So no, it's the evidence now is really going the other way, that we need to make our management strategies individualized and functional. So, if you want to go back, if you're fairly sedentary, and you don't buck a lot of exercise, and actually maybe those things aren't what you want to do, so there's no point of us just hammering them. They might not be what is the best thing to reproduce some tension for you. But if you're a mad CrossFitter and you've trained throughout your pregnancy, your body might actually need a little bit more load to recreate some tension. And when I talk about load, it doesn't necessarily mean you've got a massive barbell on your back. It's a term we apply to healing of injury. So if you torn your calf, for example, you wouldn't go straight in and do some jumps and plyometrics with load just with your body weight. So up and down onto your toes, for example. And it's the same with our abdominals and our diastasis. To start with, whatever load, whether that's with a resistance band, change of position, or simply doing a pelvic floor exercise, gets some extra tension, then that's your load at the time. But it may be that your body adapts to that, and it needs something over time, like a plank or an abdominal curl, to get that last little bit of healing. So they aren't no-goes at all. And that's where it's really important to get an assessment. And, if you're unsure and things aren't improving, work with someone who really knows what they're talking about and knows how the body heals and the change of our kind of approach to these. So don't think that if there's something you really enjoy doing, work with someone who wants to get you there. And I know you're exactly the same with that. And what is your goal? And actually, I love a burpee. Okay, right, how are we going to strip this down and modify your burpee until we get you safe to do it properly?
Yeah, I think I've been on a real journey with this over the last 4 or 5 years. And I think it's as the research has changed and as attitudes within our industry has changed. When you and I were first starting out, there was a real difference between people who were like, oh, you had your baby 6 weeks ago, crack on then, you can do a plank, you can do a burpee, you can do a sit-up. And obviously that's not the right attitude. It might be okay for some women, but ideally we've got an amount of rehab, same as any other injury. And then it almost went a whole different direction, where I would give people a completely different exercise that they could sub out if they were doing another class, separate to mine. Everyone else was doing a sit-up and I'd give them a pale-off press. And I've been on a real journey now to where actually what do you want? Like, what does the woman want? And if you love a burpee and you enjoy sit-ups and you want to do a class at your local leisure centre where there's sit-ups in the circuit, then let's get you back there. And I think that's been a journey I've been on, but I think that our industry has been on as well.
It really has. I totally agree. And there's some evidence that has come out actually only in the last few months about sort of correlation with diastasis and things like incontinence, pelvic floor dysfunction, and back pain. And at one point, we thought everything was completely linked. And if you had diastasis, that's definitely caused your incontinence, or definitely why you have back pain. And actually, the recent evidence is there's fairly weak correlation between those things. So you might have a diastasis, but a lot of people say, and I imagine this is probably where we're going to go, can I run or no? Some people are saying, well, no, you shouldn't. When actually, if you don't have any red flags for pelvic floor symptoms, you're not leaking, that actually a diastasis isn't a reason not to run. It's not a reason to pick up little ones or do a bit of weights. And there's actually a really weak correlation between having a diastasis and leaking. And while we do see a lot of women who do have back pain as well, it doesn't necessarily mean the diastasis has caused the back pain. Is it because you've got a diastasis, you're not moving well, and that's why your back is hurt, not and a little bit sore. And actually, as we get moving as a whole,
and learn to activate our core, I guess.
Yeah, it doesn't mean that's caused that. Actually, was your back pain there before? And I think that's really important evidence to listen to, isn't it? And actually, you're leaking, maybe a totally separate issue, and that's something that's really, really important to address. Not just thinking, I sort the diastasis out, that's going to work. We're looking at them as sort of separate. While everything's integrated, there's not a strong link between the two.
Yeah. We have to be careful now because we'll lose people if we start getting into it too deep. Oh, sorry, is it just us enjoying this?
That is so true. This is just like,
oh, sorry, everyone.
We get very excited about this.
Okay, so back to not our own chat. I'm sorry, no, I was really enjoying it too, but I was just thinking, ooh, I lose everybody else. So Joe, if someone is pregnant and they worry about diastasis, or they are postpartum, obviously we have our program, but if they feel like they need a little bit more support, where can they find you?
So I'm based in Cardiff at a clinic in Canton. So I'm Joanna at mamaphysio.co.uk, or Instagram I'm mamaphysio, or mamaphysio.co.uk on my website. There's lots of other information on diastasis and things on there.
Perfect. And we want to reiterate to you that our program is diastasis friendly, and all the exercises, when done with the right form and technique in the website, will be help to heal the diastasis. But if you need help,
I think that's the sort of change in focus, isn't it? That it's not just tummy muscle exercises on your back, like traditional ab exercises. Everything Betsan talks you through with upper body and lower body, and actually sometimes we need to strengthen everything else to support our diastasis. So think of it yourself as a whole body, and everything is going to support your core. So we talk you through every workout we do.
Perfect. Squat, amazing core exercise. Okay, well, thanks, Joe. It's so nice to talk to you. See you soon.
See you. Bye. Bye.